Hello, I'm Jalea with WPXI getting you the Pittsburgh news. Today, I'm interviewing a Pitt public health research scientist and a community administrator to get more information about the Hill Health and Harvest Initiative. The Hill District is a majority African American community in the Pittsburgh County. It has been around for almost 100 years. Recently, public interest groups have been working to revitalize the area. Please introduce yourself.
Hi, my name is Ragad. I am a Hill CEC administrator, and the Hill CEC is a community engagement center that's located in the Hill District.
Hi, I'm Dr. Mays Weiss from the University of Pittsburgh School of Public Health.
What would you say the biggest challenges that community members of the Hill District face?
I would say there's a couple, and one of the biggest challenges the Hill District residents face is food insecurity. Many families don't have easy access to affordable but also healthy food due to the neighborhood's limited grocery options and also their long-standing economic barriers. And this issue is tied directly to health disparities. Residents often suffer from chronic conditions like diabetes and high blood pressure at often higher rates due to poor nutrition and this lack of consistent access to preventative care. And additionally, there's also a trust gap in healthcare services, which also stems from historical and ongoing systemic injustices, which makes this a community-based needed event. It's also culturally responsive outreach absolutely necessary.
How does food insecurity cause poor health outcomes?
Food insecurity can be a major factor in a person or family's overall health. There is an overwhelming amount of data on this issue. Food insecurity puts communities at risk for obesity and chronic or lifelong diseases. And furthermore, it works in tandem with other socioeconomic pressures in the community to perpetuate generational cycles of poor health. And this has only been exacerbated by the COVID-19 pandemic.
Why did y'all target the Hill District specifically?
We chose the Hill District because this neighborhood has been disproportionately impacted by food deserts and health disparities. Despite these challenges, the Hill District is a vibrant, resilient community with a long legacy of organizing and advocacy. We are very deeply embedded in the community and we understand their needs. So this initiative is not just parachuting in with a solution. It's building on relationships, trust, and years of listening to what our neighbors have told us that they need.
So can you explain what the Hill Health and Harvest Initiative is?
The Hill Health and Harvest Initiative aims to address food insecurity, provide basic healthcare services, and raise awareness of nutrition and wellness within the Hill District. It's going to include a week-long biannual wellness fair at the Hill CEC. This fair will include a food bank and indoor health services, all free of charge and run predominantly by the community and student volunteers. At the fair, adults ages 30 to 60 can be provided with free groceries, grocery vouchers for Aldi and Giant Eagle, and basic physical exams and vaccinations. There'll also be a kid-friendly area so that participants can come and bring their kids. And we plan to collaborate with local organizations like Just Harvest and the Greater Pittsburgh Area Food Bank to relieve some of the financial burdens of the initiative and incorporate support that the community can trust.
What do you hope to achieve?
First, to reduce food insecurity, obviously, by distributing healthy groceries and connecting residents with the ongoing food access programs like SNAP and WIC. Second is to educate. We want to provide information on how nutrition ties into overall wellness and chronic disease prevention. And third is to offer baseline health screenings so residents have a snapshot of their health, but also what steps they need to take next.
How do initiatives like these help to reduce health disparities?
People that participate in community-oriented programs like SNAP and the Greater Pittsburgh Community Food Bank show reduced food insecurity and overall benefits to their health and wellness. These events don't just provide food, they bring communities together and they promote a culture of wellness and empowerment.
How do you plan to make the fair approachable to community members?
To make the fair approachable, we're meeting people where they are. We're promoting the event in trusted community spaces like churches, barbershops, and through word of mouth. We're providing childcare and kid-friendly activities so parents feel comfortable attending, and we're also bringing in culturally competent healthcare providers and also nutritionists who understand the needs of our community. And most importantly, we're designing the event with dignity and hospitality at the center so it doesn't feel like charity but like celebration and empowerment.
Any ending thoughts?
I think this is a sustainable approach to an achievable goal. With a two-pronged approach of targeting food insecurity and providing basic health services, we expect to see the overall health and wellness of the Hill District improve over the next few years.
To add on to that, this is more than just an event. It's a commitment to the long-term well-being of Hill District families. At the Hill CEC, we believe that health is a human right, and wellness begins with access to not only food, but also to care and to community. We're excited to continue building a future where every neighbor feels supported in living a full and healthy life.
This was WPXI getting you the Pittsburgh news. Check out the Hill Health and Harvest Wellness Initiative in the summer of 2025.